Hi there, and welcome to Together for Seniors, Meals on Wheels of Rhode Island's social media video series. This series is meant to provide our state's older adults and those that are involved with their care with information and resources to stay connected to community and maintain safe and independent lifestyles. I'm Megan Grady, Executive Director here at Meals on Wheels of Rhode Island. And today with us is Panita Filve. She's the Senior Community Health Outreach Representative for UnitedHealthcare. Hi, how are you?
Hi, Meg. Thanks for having me here today. I'm so excited to be speaking to you about United Healthcare. It's been great to be partners with Meals on Wheels of Rhode Island, so thank you.
Panita is also a member of our board of directors, so we want to thank her for her volunteer leadership and commitment to our mission. And United Healthcare, the workplace where she's affiliated, is a generous partner of Meals on Wheels of Rhode Island. Since 2022, they have been a active sponsor in our March for Meals public awareness campaign, and they've also been part of our Festival of Meals campaign. So, on behalf of all of us and the people we serve, we'd like to thank United Healthcare for being an important part of our impact. And of course, it's March, and so we are excited to be back in action with United Healthcare. We will be delivering a meal this Monday with U.S. Senator Jack Reed, their CEO Mike Florzik, and other members of the team. But Panita, today we are going to talk about United Healthcare's community involvement and all of the wonderful things you're doing to improve the health of Rhode Islanders. So, can you tell us about the approach to investing in community?
Oh, yes, Meg. Thanks so much. So United Healthcare is committed to making the healthcare system work better for everyone. And for me personally, relationships are important, and relationships with our community important is vitally important. So one way we can do this is by working to address some health disparities that prevent people from living their healthiest lives. We also partner with local and national organizations to gather and evaluate data, design innovative programs, and invest in the communities across the country with the goal of closing the gaps and improving health equity and health outcomes. So as you know, health impacts more than what happens in the doctor's office. In fact, clinical care is only responsible for about 20% of the individual's health. Approximately 80% of health outcome can be attributed to other factors. And 4 out of 5 physicians think patients' unmet social needs lead to worse health outcomes and also are important to address medical conditions.
Here in Rhode Island, how are older adults and other populations that United Healthcare serves benefiting from your work?
So, Meg, in Rhode Island, we collaborate with many community-based organizations. We also are provider partners to best understand the needs of Rhode Island in order to improve in access to care for critical resources. So, for example, in 2022, we teamed up with local and organizations to provide healthy, nutritious, and culturally appropriate foods through on-site distribution. So that, is very important, like for Meals on Wheels of Rhode Island. So this really is a nice fit. So glad to be a part of this board as well. Also in Rhode Island, we partnered with 6 health equity zones, or we call it the HEZs. The Health Equity Zone is really an innovative place-based approach that brings communities together to build the infrastructure needed to achieve healthy systemic changes in the local level. So the way the Health Equity Zone works, they are based on geographical areas where existing opportunity emerges, and the investments are made to address different health outcomes. United Healthcare is also working to integrate medical, behavioral, and social service supports by building a strategic partnership and collaboration, addressing gaps in care and enhancing knowledge and capacity. So improving service delivery to better address social determinants of health, or what we call SDOH, to improve health equity and focus on whole person care and individual community level.
And so let's talk about 2023. Where is United Healthcare focusing its efforts this year?
Yep. So United Healthcare has developed core service lines capacities designed to address social determinants holistically. Our goal is to improve access to, delivery of, and community resources that are all gateway to overall well-being and ultimately impacts health outcomes. And as you know, with older adults, they're living longer, so this is very important to us. We also look forward to continued partners like organizations like Meals on Wheels of Rhode Island, who work every single day to ensure the members of the communities we serve have access to resources they need to achieve better health outcomes. And I think this is really perfect, looking at Meals on Wheels and where they're going. You've extended your meals now to service other communities. So it's a great fit and a great partnership.
Well, we are so pleased to have the continued support of United Healthcare, and I want to thank you for everything you and your plan does for Rhode Island.
Thank you, Meg. Thanks for inviting us. And it's been a pleasure speaking to you today. I look forward to future collaborations with Meals on Wheels of Rhode Island.
And thank you, everyone who tuned in and for being together for seniors with us today. Until next time, we invite you to stay in touch with us on Facebook, Twitter, and Instagram. And if you know someone who could benefit from our services, visit our website at rimeals.org for more information. Thanks and have a wonderful day.
Thank you.